If we are defining stroke as the blockage of blood supply to the brain, which lead to signs and symptoms on the patient which last more than 24 hours, then I will say that TIA, or transient ischemic attack, or mini stroke, is actually stroke itself, but within the recovery of these symptoms could happen in less than 24 hours. Practically speaking, in less than 1 hour. So TIA, from its name, as a transient, it is a transient in time. It's not only the type of the cause of the problem. The cause of TIA or mini stroke can be similar to the cause of stroke itself, but the main differentiation is about the disappearance of the symptoms of stroke within less than 24 hours, or practically within less than 1 hour on TIA or mini stroke patient. So both these diseases can share the same risk factors. However, the treatment is different. I do not give thrombotic agent, antithrombotic agent to TIA patient. I don't thrombolize TIA patient with the TPA at all, because that patient is recovered within less than 24 hours, practically speaking, within less than 4.5 hours of their presentations. This recovery will lead the clinician to diagnose the patient with mini stroke. However, that patient needs aspirin medication, aspirin or clopidogrel. These tablets act as thinning the blood, preventing the platelets, the cells, of aggregating itself and causing the clot or the thrombus. And I am here suggesting that TIA or mini stroke is actually due to the clot formation inside the blood vessel of the brain itself, causing the symptoms of TIA. So sometimes the patient can be presented with speech problems, which lasted less than 1 hour, or with heaviness in the arms, or weakness of the arms, or facial weakness, or swallowing difficulties, and it will recover itself within less than 24 hours. If this happens, this is actually mini stroke. Mini stroke itself can cause stroke in 15% of patients, and that's in fact a recognizable risk factor for stroke itself. So don't ignore TIA, because it can cause stroke if the risk factor of TIA or a mini stroke ignored. So that's why we are always advising the patients to be careful in taking their medications to control the risk factors of mini stroke, because these are the risk factors which can cause stroke itself. And by this, I'll give the patient aspirin medication, 300 milligram once a day for 2 weeks, and then I will change it to aspirin of 75 milligram once a day. If it is a stroke, I give aspirin 300 milligram for 2 weeks, and then change it to clopidogrel of 75 milligram once a day.